I'm Beth Downing from Mitchell Community College Nursing Program. This is an interactive classroom activity that we set up for the concept of safety for NUR 111 to specifically focus on our students' assessment skills of the environmental safety of their clients and to compare and contrast from a pediatric client's safety environment to an adult client that we'll discuss later. Initially, we set this up within a simulation lab or a classroom setting, depending on your area that you have available. Broke the students up into small groups and allowed the students to come up in their groups and to assess the environment, write down what they saw wrong with it, potential risks or hazards for the clients, and also anything that they noted that could be questionable. Once they were done, as a class, we all came back together and discussed how many each group found and what specific safety hazards they found as discussion points to enhance a class discussion. To begin with this setup, we chose to do an infant in a crib setting. This infant is not identified. There is no identification bracelet on this infant. There's also the side rail that has been left down, and there's no parent present. The locks on the crib are not secured. This infant has been propped up in the bed. Best practice, according to the American Academy of Pediatrics, is back to sleep. Using the pillow to prop the child becomes a suffocation hazard. There is the bottle, which in this instance is a glass bottle, posing an additional risk. The stuffed animal left into the crib with the child. A hospital-made balloon. Some small items that we chose to lay into the crib with the infant, either some small candies, depending on the age you choose, they could be pills, an otoscope cover, possibly left after a physician assessment, some IV supplies, alcohol pads, a syringe. The child's IV is not properly secured where it's been pulled at. It could easily come out. The tubing could pose a choking hazard. There is excess tubing here wrapped around the rails of the crib. Also, this bag of IV fluids is a 1,000 milliliter bag, which is much too large for a child this age. Depending on the age of the child that you set up, there's also the discussion point of the safety locks, where a child that's old enough could start to change the programmed settings of the IV pump. On the overbed table, we have unlabeled medication just left at the child's bedside. Some nursing supplies maybe that could be left, a pen, tape. Maybe the parents left their meal, a bag which could pose a choking hazard, a fork. There's also the blood pressure cuff, again another choking hazard. Also, the size of this blood pressure cuff is much too large for this size child. Laying into the crib is the string from the nearby window shades. The flowers on the windowsill pose a poison risk if the child could eat them. Also, these ones are in a glass vase. The box of gloves is also within reach of this child. And on the wall nearby are electrical outlets that are not plugged. Again, another safety hazard for this child. These are just some ideas to possibly get you started with how to set up a similar situation for your students. It also helps to clue them in on really noticing the environment. We choose to teach safety at the beginning of the semester before the students have had a lot of experience in the hospital. So their assessment skills when they walk into a room to notice things are not always as thorough as what ours would be as nurses. So to try to help them look at the whole picture and understand and see all of the little things that could pose a risk to their patients. Thank you.